Okay, hi, PsyQ community. I'm Dr. Miranda Fisher, Medical Science Liaison at Otsuka Pharmaceutical, and I'm very happy to be here today with Ms. Laura Kaponer. Laura is a certified peer support specialist, a mental health advocate, and a social media blogger. And she is actually taking part in an 8-part podcast series here on the patient caregiver section of PsyQ, where we'll be learning some of her perspective on a lot of mental health related topics. So welcome, Laura. We're happy to have you here.
Thank you for having me. Hi, hello, friends.
So today, the topic of our discussion will be about recovery and how this process really is anything but one size fits all. So Laura, what does your recovery look like for you?
I think the toughest thing is to distinguish between recovery and recovered. So for most of my recovery process, I was thinking I'm going to be cured, I'm going to be healed, I'm not going to be symptomatic anymore. And that's not a realistic expectation. It also puts a lot of unfair pressure on me or the person going through the recovery process. So I had to accept that there's no such thing as recovered. Recovery is an ongoing journey and it's not linear. So sometimes I'm going to be ahead, sometimes I'm going to go behind, and it's just going to depend on the resources I have at the time and my mental state. From one day to the other, my capabilities might change. Recovery is about taking personal accountability for my symptoms and making sure that I manage the challenges that I'm going through in my life the best I can at the time.
Yeah, so what do you wish you would have known, or that you know now that you wish that you would have known earlier after your diagnosis?
You can't do it alone. The hardest part for me was thinking I don't need people and I have to take on this burden myself. I'm a big believer of a multi-level support system. So it includes professionals, peers, and family and friends. They all give a little bit of something different. Family and friends can help give you an outsider's perspective. They know you best, so they're going to have an idea of your good days and your bad days. And if you're open to have a dialogue with them, they can let you know when you're being symptomatic and maybe when you need to be a little bit in check. Professionals are going to be your prescribers, and they're going to be the ones that aren't personally invested in your recovery. So they can have a strictly professional